Hello and welcome to Addressing the COVID-19 Crisis, an open forum webinar series for pharmacists. I'm Michael Hogg, President of the American Pharmacists Association, and your host for this broadcast that we do each and every week to try to provide information and take your questions and answers, provide answers about what's happening during the COVID crisis. We're very pleased to have you with us today. We're going to be doing something that we've never done before. The APhA Board of Trustees is joining me today for this webinar in a bit of a listening session. APHA's board engages in strategic planning to try to ensure that the association's resources are dedicated to the things that are going to move the profession forward and the things that are important to you as pharmacists. Now, many of you, as we registered for today's webinar, did in fact submit questions in advance for the APhA board that you'd like responded, and some of you submitted comments that you just wanted us to be able to have, and we really appreciate that. But before we get into the logistics for today's call and how we're going to manage it, I want to tell you that there will be three individuals in a little bit that'll be joining me live on camera, and that is Sandra Leal, who is our president-elect from Tucson, Arizona. She's a practice innovator and CEO of a large company. Brad Tice, the immediate past president of APhA, who is also a practice innovator and a corporate CEO of a large company here in the U.S., and Scott Knorr, who's the APhA executive vice president and CEO. Now, in addition, as I mentioned, the entire APhA Board of Trustees is joining us on today's call, and I want to introduce them to you now. Joey Mattingly is the APhA Speaker of the House of Delegates and trustee from Baltimore, Maryland. He practices in academia. Kathy Kuhn is the President of the Academy of Pharmacy Practice and Management. She is in the health information technology sector as a pharmacist, joining us from Columbus, Ohio. David Now is the president of the Academy of Pharmacy Research and Science. He is in academia and based in Ada, Ohio. And Sydney Tu is the APhA ASP president, a student pharmacist at St. Louis College of Pharmacy in St. Louis, Missouri. In addition, we have trustee treasurer Greg Fox, who is a community chain pharmacist from Cincinnati, Ohio. Sean Jeffrey, who's a health systems pharmacist from Hartford, Connecticut, and Randy McDonough, who's an independent community pharmacist from Iowa City, Iowa. Also, we have Magali Rodriguez de Bittner, who is an academician from Baltimore, Maryland, Teresa Toll, an independent pharmacy owner from Sebastian, Florida, Alex Varkey, a health system pharmacy director from Houston, Texas, and Wendy Weber, trustee from Bellevue, Nebraska, as a consultant to large corporations. Well, that's our APhA Board of Trustees, and the way we're going to go through this today is that in just a few moments we'll have our two additional presidential officers and our CEO join us. I'll give them a couple of questions that came in ahead of time, but we want to call to your attention, and the go-to webinar control panel is a questions tab. We would like to ask you to start inputting questions that you have for the APhA Board of Trustees now. More important, and we're happy to answer questions, but more important than your questions are your comments. This is a listening session with the APhA Board of Trustees. We're listening carefully to those issues that are important to you in practice now. We would like to hear from you. Type into the chat box what you believe the most pressing issues for pharmacy and pharmacy practice are. You know, short sentences, whatever you want to say, just let us know. We will be reading and reviewing the questions that come in on the questions tab, even if we don't perhaps get to all of them in the live webinar. So we want as much feedback as we can possibly get. It helps us as we do strategic planning to ensure we're putting the resources of the association in the right places to further the profession. So we invite you to do that. Now, I also just want to say that we love for this to be very interactive. And for those of you who have joined us now for all of the weeks that we've been doing this, we do offer the opportunity for our guests to speak and to have your voice heard, not just typed into a question box. If you are on a landline phone or a cell phone, we ask that you please go ahead and input the GoToWebinar audio control pin into your phone, the audio control pin number into your phone. That way, when it comes time to call on you, we will be able to unmute your line on our end and call on you, and you'll be able to speak. If you're joining us using your computer audio, it's even simpler. All you have to do is look at that GoToWebinar control panel, click on the little microphone. It goes from red to green, and that means that your line is live. We will unmute you on this end, and of course, you'll be able to speak. If you do not want to speak and you just want to give your comment and have me read it or have us be aware of it, just type the words "no audio" or "Michael, will you say this for me," so that I don't have to say it. Anything you want to put in there just to give me a clue that you would prefer not to speak out loud. That way I will know to read your comment in. In addition, there is a brief set of handouts, not extensive this week, given that we're doing this as a hearing. But if you want to, under the handouts tab, you can download today's handout. And you can also access that at pharmacist.com in the COVID-19 resources page, which is the place where we keep all of the audio recordings of all of the weeks, including this week's recording, will be made available in that location. Now, I believe that we have covered all of our ground rules that we wanted to get to you today, and I don't want to take any time away from being able to hear from each and every one of you. So to get us started, I'll just ask if Sandra and Brad and Scott would turn your webcams on and join me on screen. I'd appreciate it. Scott, Brad, Sandra, thank you for being here and for being the voices today of the board. Appreciate it. All right, you're all there. Good. Sandra, let's start with you. One of the questions that we received just in the beginning part is, what are the perspectives of the APHA board on how COVID-19 is really going to impact the profession in the long run? I mean, we've seen a lot of change happen in the short run. So what's your thoughts as the president-elect of APHA about how COVID-19 is going to affect us in the long run?
Well, we're seeing a lot of incredible changes with the profession. We're seeing scope of practice changes. We're seeing more recognition of the essential services that we provide. So as a board, we're really looking at how to maintain some of those gains that we've worked really hard for beyond COVID-19. And so that is where I think we're really going to have an impact in the next year, next couple of years, to maintain the scope, to make sure that we are recognized, and to essentially reinforce what we already know. Everybody on this call knows the essential role we play in access and addressing people with access issues. So I really feel that that's what COVID is going to do. It's just raise the attention of the incredible impact that pharmacists have, and we have to continue to push for that recognition model.
Brad and Scott, I wonder if you have anything that you'd like to add about COVID-19 and how you see it having changed the profession. And, you know, maybe Brad, could you contemplate or think about what some of these temporary authorities we've been given, do you anticipate some of these things to last well beyond the pandemic or not?
I do, Michael. I think we do. We've definitely seen, even actions just within the profession from NABP with the NABP passport program, practicing across state lines. We've seen advances in telehealth. We've seen expanded opportunities and even preparation for the COVID vaccine becoming available and childhood vaccinations. It's really been an opportunity to increase and have others expand upon the value that pharmacists provide and get that in place, and giving us a chance to prove ourselves, and we have, and it will continue.
Scott, I know that one of the hottest topics that you've been talking about on social media and in other places is payment reform. Can you talk about how COVID-19 has really underscored the importance of payment reform to ensure patient access to medications and the services of pharmacists?
Yeah, absolutely, Michael. Thank you. It's very exciting to speak here from the World Home of Pharmacy and represent our Board of Trustees at this meeting today. And payment reform is really the cutting edge. We had our strategic planning session yesterday, and that's the primary thing we're looking at. And COVID has given us a tremendous opportunity. I think pharmacists have proved themselves. This is really healthcare's 9/11, just like the first responders ran toward the burning buildings. Our pharmacists ran toward their patients to ensure continuity of care. And the administration, everyone wants to increase COVID testing. We said, put us in, coach. We can do it, but we need to be paid. Health and Human Services recognized pharmacists for testing, for pediatric vaccines, because as we have COVID, less people are going out. We have fewer pediatric patients getting vaccines, and now for COVID vaccine administration. It's clear that pharmacists can't do this without being remunerated. We're not trying to get rich off this, but put us in, coach. We're here, we're ready to play. COVID is our chance to really, and we've demonstrated, our pharmacists, our frontline pharmacists have showed society that we're here. We are the most accessible healthcare providers. So it's been a fantastic opportunity to really get the message out. And the things we're seeing from HHS are going to really help us in the future, Michael.
Yeah, that's great. I must say that shifting COVID has also created another stress point. And, there's an elephant in the room, so to speak, in pharmacy today. And Brad, I'd just like to get your reflections on this. We hear from pharmacists on social media and through member engagement that workplace conditions are not ideal, and that pharmacists are finding themselves with less staffing to be able to provide the care to their patients, and that it's a tough environment. Well-being of pharmacists is stretched, and resilience we hope would improve. But can you comment, Brad, just a little bit about workplace conditions and how APHA is trying to address that? Because I think pharmacists kind of feel alone out there, and I'd like to kind of know what APHA is doing about it.
Absolutely, Michael. And we know it's tough, and we've heard this, over the last several years. The board started taking action on that 2 years ago, and then during my year last year, we had the Wellbeing Summit, and from that, built out our actions, including a partnership with the Mayo Clinic to establish the Wellbeing Index. And that, one of the reasons that's so important is it provides us data that we can have objective discussions, and we can target and identify and target where the issues are, what states, what areas. We've been able to publish and share that information. And we've had behind the scenes, we've had tough conversations with C-suite level people from these large corporations, and we've seen improvements in some of them. And that's not perfect. But it's a slow process, and I think we know that one of the root causes is what Scott just addressed, which is the payment reform. So we are very strongly addressing payment reform and those conversations. Scott has stepped it up on the podcast and been very direct. If you haven't heard them, you need to go listen to them. We're tackling the issue head on and doing everything that we can to help improve the environment. But I think for everybody, it starts with getting that payment reform in place.
Michael, topic one more time, Sandra. Just wanted to ask you a question. We received a question in advance of today's webinar, actually a comment from longtime member Don Downing from Washington State. And Don says this: the COVID-19 pandemic has shown the negative impact that chronic medical conditions have on the COVID-19 death rates, especially impacting people of color. CMS provider bills that are received center mostly on rural white elderly people, and we need to address equity in our healthcare system. Sandra, what is APHA doing to address health equity? And could you just speak a little bit about that?
Yeah, the comment that was made by Don is incredible. The inequity that we're seeing currently and the people that are being impacted is tremendous. You know, I look here in Arizona where I'm located, we've had 21% of our deaths associated with Native Americans, where they only represent 4% of our population. And if you look at African Americans, if you look at Latinos, they're disproportionately being impacted by COVID. So here at APHA, we're looking, we just started a task force to address structural racism in pharmacy. And we're taking a look at a lot of these hard issues where we have a lot of inequity. And so we have to address it because it is simply wrong that our patients are struggling. We need more representation in our profession. And APHA is taking a very hard look at how we improve a lot of these issues and advocate for the right things, because we all went into healthcare to help patients have better outcomes, and we cannot have disproportionate care across the United States. So it's not something we're going to solve overnight, but we are very invested in having solutions that bring the membership, activate you, engage you to solve some of these problems.
Well, I'm sure we'll have some more questions as we get along from our audience about issues of racial injustice and so forth, because that's a hot topic in our profession today. I want to take another question that we received in advance from pharmacist Stephen Kennedy of North Carolina. Recently, the Bureau of Labor Statistics revealed that pharmacists were the only healthcare professional that had a negative rate of growth projected for the future. Advocating for pharmacist provider status alone is not going to fix the problem. What is APHA going to do to ensure that this problem of declining jobs available for pharmacists is addressed? I'll throw this out there to any of the three of you who'd like to speak on it. Brad or Scott?
I'll take a stab here, Michael. And, you know, I get that provider status alone is not. But, you know, I am most recently from Ohio, where I spent the last 9 years, and the Ohio Pharmacists Association has been incredibly successful in getting major payers for Medicaid. They passed a state provider status law, and now they have United Healthcare Centene paying pharmacists to do actual cognitive functions, which is going to help all kinds of things, right? The reason Ellen Gabler wrote the article Chaos in Chain Pharmacy is about how it's all about reimbursement, and we have declining reimbursement, we have PBM issues, and that causes our pharmacists in high volume stores just to be machines. So provider status is actually paying pharmacists in Ohio, and there's other states. We just had someone on from Washington. Washington's had a form of provider status since 1978. And so that is a huge part of the solution, is getting pharmacists paid. Now, you can talk about the too many schools. Certainly, there's, you know, it's kind of like a sine curve. There's years ago, we didn't have enough pharmacists. So we opened lots of pharmacy schools. The schools that were there expanded their pools, and it went up. And now things are going the other direction. So we need to get pharmacists paid for the things that we went to school for, and that will be a big part of the solution. But Brad, I'd let you expound upon that.
Yeah, thanks, Scott. And I would, you know, we are fully supporting and a part of the effort with the Rutledge versus PCMA Supreme Court hearing. You know, there's action taken on pricing reform. We're, you know, heavily supportive, and we had a great presentation this morning on that, as we're really looking at what else can be done and what else needs to be done and what else we will do. We are dedicated to payment reform. We're also dedicated to provider status, but not just provider status. The staff in the government affairs has made great strides in the last several months around incident to billing, getting pharmacists paid for their vaccinations. And so there's lots of different services and additional services that we're working on to make sure that pharmacists get paid for both the product, get paid for services, expand service delivery options, and also just to include pharmacists and make sure we're set up for value-based payment programs as they evolve, because we also know the timing's a little squishy, but we know that those are evolving, and pharmacists have to have a seat at the table in value-based payment programs.
Okay, we're going to start taking questions from our audience, but before we do, we're going to do a polling question. We would like to get a little bit of information about all of you who are on the call today. So I'll ask the staff to bring up our first polling question. First polling question is, how would you describe yourself? Are you a longtime APHA member, a new APHA member, a student pharmacist member, or a non-member? We have a open dialogue and open opportunity for all people in the profession to come to these webinars each week and gain information. We'd just like to get a little bit of a gauge of who's on today's call. So if you don't mind, just vote, and we'd appreciate knowing a little bit about our audience today. Okay, we've got a good response rate. If we could see the results of this, please. So about 70% of you on the call today are longtime APHA members, and welcome back. New APHA members, welcome to you, as well as our student pharmacists. And for our non-members, we very much welcome you and welcome your opinions and insights into the profession as well. So thank you for that. We're going to unmute the line of pharmacist Gary Merchant. Gary Merchant has a very important comment that he'd like to give some feedback to the Board of Trustees. So Gary, we've unmuted your line. Please go ahead and give your comment to the Board of Trustees.
Thank you, Michael, for that. One of the things that I wanted to share with you folks on APHA and the board, many times things happen at the national level, start at the state level. And many things at the state level ultimately migrate themselves to the national level. We've become sort of a test tube laboratory that things work their way through and work out the bugs, if you will. As a state legislator, I didn't realize this until I ran. From North Carolina to Maine, 13 states, there are only 2 pharmacists in a state legislative body. So my question to you folks is twofold. One is, how do we get more pharmacists involved in the legislative process, both at the state and federal level? Because being on the Board of Pharmacy for 10 years was nice. I realized we had a lot of authority as the board member, but the real authority is at the State House or the federal government. If you really want to make a change, and I support everything you're talking about, it comes about because we have statutory authority granted to us, whether it's scope of practice, payment models, and so forth. So I'm looking to APHA to create maybe a forum, not just for pharmacists that are state legislators, but for state legislators themselves that support pharmacy, to network amongst themselves using something like you're doing today to share knowledge, share resources, share work we're doing together for the benefit of the profession. So thank you.
Gary, thanks for that comment. I want to ask you another question in follow-up to your comment. That's valuable information, and the board will take that information and we'll work with staff on that. It's a great suggestion. But Gary, I'd like to ask you, what prompted you as a pharmacist to decide to run for the state legislature? What motivated you to take that action and put yourself out there?
When I was on the Board of Pharmacy, working with a peer, before I became president of the board, we tried to elevate the pharmacy technician and have them assume more responsibilities. Basically, if we don't unshackle some of the tasks that pharmacists are doing today at the community level or even in a hospital, it's hard for us to then take and add more workload to them if we can't shift the workload they're doing today to someone else qualified. What the State House told us, we didn't have the statutory authority to do that. So I said, okay, I'll become a state legislator. I'll work with my peers. I was able to pass a law to create, first in the country, a licensed technician who has expanded scope of practice, truly a license like an LPN in nursing, to take over many of the tasks and duties that a pharmacist today can do, with the intent to allow them to do more clinical work at the community level as well as in the hospital. What I will say to this, I am proud of myself. I was able to get the bill through the House and through the Senate on a voice vote on both committee and both on the House floor and the Senate floor, and signed by the governor. So we're working with the Board of Pharmacy today to implement the exam and also the rules behind it. So what I found out, though, is that many people in the legislative body, they see us, folks. They see the white coat. They really, really trust us. They have a tremendous amount of support for us. But quite frankly, they don't know what we do. And Scott, you've been in a hospital background. My background's in hospital too. And I say, there's a pharmacist in a hospital? Where do they hide them? All I can say to you folks is that my peers, I spend most of my time, not to preach to you folks, but educating them about the profession and what we do, because they quite frankly don't know.
Well, that that is fantastic. Well, thank you. First of all, I want to thank you for your service in a state legislature. That is really, really important, and so thank you for that. I want to move on. We've got a lot of questions in the question box, and we need to hear from as many people as we can. We're going to go next to Emily Prohaska. Emily Prohaska, you've got a comment about reimbursement. I'd let you make that. We'll unmute your line.
Thanks, Michael. I just agree with the comments that have been submitted so far, and just wanted to say that equitable reimbursement for not only the medication product, but the pharmacist knowledge is important for the viability and sustainability of our profession, especially in these more innovative roles that are non-dispensing or clinic based or ambulatory focused. So thank you.
Thank you for that feedback. Very important feedback. Pharmacist Starlin Hayden Grading has a comment for us. Starlin, we're going to unmute your line so you can give some feedback to the board.
Hi, everybody. I'm sorry we're not all together, but I miss y'all, so it's nice talking to y'all. But I will say on all the CMS calls and things that we're going through trying to figure out our reimbursement process, that we have a lack of education within the reimbursement worlds, commercial reimbursement as well as government reimbursement, that if there's a nurse consultant that is in charge of the quality assurance and the fraud and abuse, and we're trying to bill at a higher rate or do things, they're not understanding it. So I want to help build our profile better, and I encourage everyone listening to donate $1 to our PAC fund so that we have the money to present this appropriately to the government agencies. So thank you.
Thanks, Starlin. And pharmacist advocacy is really important. And I think what we've heard now already from quite a few people, both in the pre-received questions and those comments that we've received so far, is that payment reform in our system is really essential, both payment reform for the way products are reimbursed and also payment reform that fully recognizes the access that patients need to pharmacists' care services. And so I think that's something that we all recognize is very important. Now we have Kaylin Bowman. Kaylin Bowman has questions for us. Kaylin, you've got a couple of questions. How about asking your first one first, and then we'll take additional questions from you.
Sure. Can you hear me okay?
Yes, we've got you.
Oh, great. So the first one was, in talking about reimbursement again, is how does that translate down to the retail, the community pharmacists and pharmacies, where we talk about reimbursement structures for providers doing the COVID testing, doing immunizations, and how is that going to translate to additional staffing, supplies, hours, technician help, or interns? I'm already bombarded with daily shots, and thank goodness on the days I have interns to help out. But how is that even going to translate to a pharmacist's paycheck? When we talk about reimbursement, at what level are we discussing how that gets back and trickle down?
So we're going to take two comments here. I think all three of our officers want to be able to comment on this. Brad, we'll take your comment first, and then we'll go to Scott and then Sandra.
Yeah, thank you for that, because that was actually one of the biggest learnings, I think, as in the last few years for me personally, as we've been pushing practice advances, and oftentimes that can lead to more stress in the practice environment because there's more different types of services to deliver. And so that's where I think our efforts have really grown in both payment and also well-being, to make sure that we're addressing how they're implemented in practice and make sure they're done the right way. I would also add that a part of how that will trickle down, one is through payment reform to fix what's going on in the perverse incentives and the just structural issues in payment that are providing the wrong incentives and too many dollars going to the middleman. But then secondly, the more services and the higher reimbursement we can get for services is going to end up in more opportunities for you in practice when done the right way.
Right. Scott, how about your comments on this topic?
Yeah, absolutely. We spent a lot of time talking about that. Our payment model is absolutely broken. You know, we're blowing it up and we're going to rebuild it. We hired superhero Antonio Cha-Cha from the Ohio Pharmacists Association, who's blown the lid off of payment reform, exposed the PBM shenanigans and shell games. Antonio is, you know, he showed that in Ohio in Medicaid 1 year alone, PBMs sucked out $244 million of spread, and that's nothing to do with DIR fees and rebates. He showed in Florida that Caremark paid their own pharmacies more than they paid community pharmacies. So we got his leverage, his expertise and leverage. He also passed provider status laws in Ohio. We got pharmacists being paid in community pharmacies by the major insurance companies for cognitive services. So, you know, it's going to take a while, but eventually, if pharmacies, if chain pharmacies are getting paid to have pharmacists do cognitive services, they're going to staff for it, right? Because that's a revenue stream. It's not a revenue stream. All it is how fast can you count and can you man the drive-through window? So they're very, very much related.
Sandra, I'm going to ask you to comment on one specific piece of this. I think one inherent in Kaylin's question, it sounded to me like was also this idea. If I, as a community-based pharmacist, and I think most of our listeners know I used to own a pharmacy, so I have some knowledge of this. If I, in my community pharmacy, and let's say I'm a chain pharmacist employed by a chain, should I expect my salary to change based upon the functions that I'm doing within the pharmacy, or am I paid a wage based upon, you know, my employment? So if pharmacists are doing more, let's say, clinical services, should the pharmacist be receiving any of that money, or is that the employer's money? How does that all work? What's the expectation there? We've heard a lot of discussion about that in the profession. I'd like to get your perspectives.
If we do it right, if we realign correctly, the incentives would go directly to the pharmacist. And this is essentially looking at the medical model, right? Physicians actually get compensated more if they're more productive, if they have more RVUs, which means that they're delivering care that's more complex. So when we're looking at payment reform, we have to look at it in the context of the provider and associate the interventions that the provider is making through our NPI and other models that the physicians and other practitioners are using. If we continue the model that we're at, we're not going to see the fix. We're just going to keep asking for people to do more and then figuring ways to just essentially take that profit and run with it and not compensate the right individuals to be able to do that. So unless we actually get it right, we're not really going to fix a problem. And I get like the frustrations. I see this all the time on social media. People that are practicing in retail. It's great to have public health, to vaccinate patients. That's wonderful. But when you have to do so many quotas on vaccines and when you have to do so many fills on prescriptions and you don't have staffing, there is no incentive, right? People are frustrated and we have to address that and get to the root cause of the problem, or otherwise we are going to have a very disenfranchised group of people out there that are not truly practicing the way that they were trained to practice. And that's the fundamental problem that we have in our profession right now, that we are not getting recognized as individuals for our contribution to the healthcare team.
Great comment, Sandra. I'm going to call on pharmacist Frank North from Texas. He's got some comments for the Board of Trustees to hear as well. Frank, we're unmuting your line.
Hello, thank you, President Hogg. I just had several comments and concerns about the things that we talked about, and I'll be brief. Is based off of the previous conversation about legislation, we need to really learn and to be more aware of things beyond pharmacy and really pivot our conversations to how it affects the individuals in the legislature's constituents and not necessarily our dollars in our pockets. And so I live in Texas and we have a pharmacist that is running for a position in Texas, not my district, but I've heard, because I want to be a part of the conversation, and I hear zero about education reform, criminal justice reform, different things of that nature outside of the scope of just pharmacists and PBMs. And so to the point, most legislators don't know what we do, and we don't even really know what PBMs are doing other than taking advantage of us. And so when we have those conversations, we tend to lose them. So we have to have more reach. I would like to see some leadership training programs that really talk about what the legislative process is and how do you develop policy that could even be riders to other policies that I think will move the agenda for that. And then my comments about the current conversation is basically we have to find ways to incentivize and compensate pharmacists for the good work that they're doing on the front line, as opposed to the corporations kind of just eating it up. And so I think that takes conversation where the leadership outside of the stores and on the front line are probably not in the room. So a lot of my colleagues have issues when they go to meetings or they have a space to talk about their particular issues, their boss is in the room, right? And so how could they share their experiences when their boss is in the room talking about how they enjoy doing what they're doing? So I think we have to, have those serious conversations and look at who's in the room and what could possibly be limiting the conversations from being more authentic. Thank you.
Thanks for those comments. I mean, the reality is that we need more advocacy involvement, and sometimes pharmacists don't know where to start with that. So it's good feedback to the APHA board that we need more engagement in training of pharmacists and the legislative leadership. And I so much appreciate your comments, Frank, and also Gary Merchant's from earlier, because as highly engaged pharmacists in the legislative process, as you all understand better than any, how critical it is for pharmacists to be involved in that. So we've got to address that. There's no question. I want to get to George Perchak. George Perchak has a comment here about workflow. George, the board is listening to you.
He's self-muted.
Just click on that green microphone there, George, and you should be unmuted. We still can't hear you, George.
Yes.
Now we got
So,
you. Now we got you.
what can APHA do to provide demonstrations in making the workflow in a busy pharmacy sufficient to insert a pharmacist to provide cognitive services that he or she can be reimbursed for?
Great.
We have busy pharmacies, and it's filling one prescription after another, nonstop, and they're all queued up. Can the APHA provide some demonstration of how you can insert time into that workflow so that we can provide cognitive services for which we will get reimbursed?
I hear you clearly. I think if I could restate what you're saying is that we pharmacists need assistance. They need someone to help them shift their practice. That pharmacists really do want to provide this direct patient care service, but the reimbursement model is so focused on drugs that it's difficult to know how to implement those clinical care services in a way that's financially feasible. And George, your comment is great. The board is listening to this, and helping pharmacists find pathways and models and having mentorship in implementation is really an important thing. Brad, you've got a comment on this?
Yeah, I might just add a resource, and APHA we've put out different practice-based resources that are on the website. There are tools for reimbursement support, but one other tool is e-communities and getting involved with the special interest groups, the medication management special interest group within the Academy of Pharmacy Practice Management, so that you can interact with peers who have worked on, figured out some of those workflows. I've been a part of that throughout my career. Others are that are engaged in that type of a service and find out what they're doing through networking. Sometimes that's by starting with one morning a week that you're dedicating time to, or 1 hour a week. After, there's been very creative solutions, and a lot of that networking, which is harder to do now since we're so social distance and not meeting in person. But I think that's been one of the pieces of value of membership in the organization over the years, which is the interaction and learning from each other. And that I just didn't want that to go forgotten.
Yeah, and you know, Brad, I'll just also add that there is something out there called the CPSN Network, Community Pharmacy Enhanced Services Network, that's established and is moving across the country for community pharmacists to help have lean on each other and provide support for each other for implementing clinical care services into community pharmacy practices. And I would encourage you, George, and others who might be on the call to go to the CPSN USA website and connect with your CPESN luminary in your state. That is another great way for you to be able to get some of these resources. And APHA fully supports the work of CPSN USA, as well as all other networks of pharmacists who are trying to advance community-based care and clinical care services across the continuum of care, whether it be in the hospital setting or the community setting. So we're really want to encourage folks to use that. Now, I also want to call now on, let's see here, what have I got here? Starlin, did you have an additional comment? Starlin Hayden Grading, we'll unmute your line. You had an additional comment?
Oh, I have all kinds of comments, as you know, and I'm talking to the choir here. So I really want to appreciate you giving everyone, all of you, giving all of us a chance to side in, since we haven't been able to have cocktails during a meeting or anything. But you really need, it starts at the healthcare is local. So your local pharmacy groups, then your state pharmacy associations. Many of the state pharmacy associations are getting CDC grants, particularly to embed pharmacists and create networks between hospital pharmacies, rural pharmacies, community pharmacies. State of Illinois, we're very involved. We've got pilots that started this month. And so it's very, very active, and we need your help. We need your positive interaction, and we need your story so we can change the belief mechanism of what pharmacists can do. So please get involved. The medication management SIG just posted a process to get to volunteer. So please get involved and please help us, because some of us are going to retire in 6 years. So please come now, join now.
All right. Well, thanks for that comment, Starlin. We received a comment, and the question asker has asked to remain anonymous. So I'm going to respect the anonymity of the question asker on this question. Here's the question. With all of the pharmacy organizations at the state and national level, sometimes it doesn't seem that the organizations are working together or speaking with a unified voice. Is that an accurate observation, or are the organizations working together? Scott, I think you, as the new CEO of APHA, have started to work with your colleagues from the other associations, and I would note that many of our sister pharmacy organizations have representation on today's call, and we're glad that that all of you have joined us. But Scott, I'd like your perspective on this question.
Yeah, absolutely. I think it was 9 o'clock this morning. We have a coalition that's been meeting of all the major pharmacy organizations. It has been, in lockstep. Now, we're all advocating on our own, but we're working together. And I tell you what, the HHS guidance would not have taken place if it wasn't for this coalition working together, having a common message. 3 of our organizations talked to the National Academies of Science about making pharmacists tier 1 in the vaccines. For pharmacists to get them first as essential healthcare workers. And I am extremely proud of the teamwork and collaboration we're seeing throughout our organizations. Our government relations people all talk. Can we do better? Probably, but I tell you what, this group is all dedicated to provider status and payment reform, and it's been fantastic to witness. So, folks obviously are advocating for their members individually and make their own statements. We got a letter together very quickly when the AMA and the American Academy of Pediatrics came out against pharmacists' expanded role in vaccinations, and all of us signed a letter and sent that off right away. We wrote an op-ed, other people have done that, so I think there's a tremendous amount of teamwork on the important issues.
Yep, I think that's the key thing is that, the pandemic has really brought the profession together. And I just want to say to our sister pharmacy organizations, I'm proud of the work APHA is doing. I'm proud of the work that you're doing too. I'm proud of the work that we're doing together. What I see coming out of our profession is amazing. I hope and pray that when the pandemic's over, that all of us will see that we are better together than we are working in silos. And I think that you all have worked so well together across all of the associations. As a pharmacist, it makes me proud, and I really, really do hope that this carries on for the future, that we continue this pathway. Now, Michael Murphy is on. I'm going to let Michael have a chance to make a statement as well.
Thanks, President Hogg. I just wanted to voice my agreement with the past statement that was really discussing we as professionals voicing our concern on issues that can impact our patients, such as social and civil issues. I really appreciate the board for all of the press releases and work you've already done on issues such as gun violence, gender inequity, immigration detention, but I truly believe that further action needs to be taken to advocate for these issues that impact our patients, similar to what other healthcare professional groups have done to advocate for legislative and regulatory changes that supports these and other social causes. I don't think that we need to take political stances as an organization, but if policy comes out that could harm patient access to care, for example, repealing the Affordable Care Act, I feel it's appropriate that we voice our concern and advocate for our patients' access to medications and healthcare. Thanks for the time to speak.
Thank you for that input and that insight, Michael. Very helpful. We appreciate it. I know the board hears you loud and clear on that statement as well. I want to ask a question on behalf of students who might be on today's webinar. What is APHA doing to try to expand the career options for pharmacists beyond the traditional career options in hospital and community pharmacy? Is APHA doing anything specifically to help really expand career placement and career preparation? And I wonder, Sandra, do you have comments on that, or Brad?
So this is Sandra. I was just going to say one of the areas that we are focusing on is being able to address the value that pharmacists bring to the table, because a lot of us that are on this call are innovators, we're entrepreneurs, we're looking at current policy that's out there to be able to find those new avenues for pharmacists to practice. So I think we're very actively talking about in our strategic plan. And then we even talked about education and how that is being impacted by it. I know Brad probably has more to add because we're in the same area of trying to create new opportunities. Pharmacogenomics is one that comes to mind immediately, but there are so many different opportunities around population health, around public health, where pharmacists have a significant voice that they can actually practice in that's completely different from what you probably think of pharmacists as doing. And we have to educate others about those values that we bring in practice and in administrative roles and so many other roles that are what we consider non-traditional now, but I think are really important for our future.
Brad, anything to add to that?
I would just add that, one of the most rewarding parts of being a part of the board for the last really decade has been, through some of the resources that we've been able to structure with the building and strategic opportunity fund, we've created products and made major investments in provider status, a program called Advance, which is really to help advance pharmacists and help organizations advance their pharmacists to different types of practices. So that could be immunizations, that could be pharmacogenomics, that could be medication therapy management, provider status, whatever, but trying to help organizations and groups move practice forward and do it in the right way. And I think that addresses some of the practice issues as well. We've created pharmacy profiles, which helps pharmacists credential to be able to provide those services within organizations once they're established. And so we're really working to get new opportunities out there and include entrepreneurship and innovation as a part of the strategic plan and how we support that within practice. That's just been a really important part. And just because I know we're going to run short on time a little bit, it's been mentioned the importance of the PAC. Gary mentioned it and Starlin mentioned it. You know, as a member, all you have to do is text donate to 50155. I know Mary Ryan will appreciate me doing this. Donate to 50155. Our average donation is just over $50. This is an election year. We need our political action committee funds to go 10 times what they are. And if everyone would donate $50 to $100, we'd make a lot of progress there. And, you know, donate more if you can. But we need a louder voice, a stronger voice through those dollars, and that will help get us into those legislative positions and get the right people supported that can support us.
Yes.
Brad,
Scott, please go ahead.
A step further, okay? So we mentioned, you know, the AMA, AAP came out against pharmacists being able to vaccinate and do COVID testing. We're outgunned, right? AMA's got ridiculous lobbying, okay? And they are fighting for provider status. We need you to step up. 8% of the people on this call are not APHA members. Get off your butts. We're fighting for you. You need to be part of the solution, okay? You cannot succeed in this profession if we aren't all involved. You need to be active members. Help us kick butt, okay? The AMA is out there. They got a big pack. They got members. We're fighting that. Help us fight it.
I got a correction. Mary Ryan corrected me. It's text action to 50155, not donate. So sorry about that. Action to 50155.
Next week, Michael, when you ask how many people are not members, it better be 0%. We're having fantastic programming here for COVID. We are kicking butt. We're fighting every day at the Capitol. I can see right there. Join us. We can't fight alone.
That's right. So I'll have the staff correct me in the text box that it's action to 50155 if one of you could put it out there. Well, Scott, Brad, Sandra, thanks for joining me. I'll let you turn your cams off now. Thank you so much for that. I do want to do another polling question here for us. We want to get just a little bit more information from you. Of all of these topics we've talked about, which of the following priority is the most important? If you had to pick one, and I know they're all important, but if you had to pick one topic that matters most to you, which of these topics do you believe is the most important? So I'll give you just a minute to read those. Is it recognition of pharmacists as providers, improving well-being and resilience, career development, job placement, workplace issues and staffing, or fully utilizing my knowledge and skills in patient care? What is your belief as the most important issue in pharmacy right now today? Let's get a few more of you to vote. Don't be shy. All it takes is a little click right there on the screen, and we can count your vote in. Okay, well, let's take a look at the results and see how many we've got. So it looks like that there's a split here, and it looks like the top vote getter here is recognition of pharmacists as providers as the most important, workplace issues and staffing being second, career development, job placement, and fully utilizing my knowledge and skills being tied, and then well-being being the last of the 5 topics. Well, thank you for that input. Now, I want to take just a moment and discuss a few things with you related to APHA's ongoing activities. We'll be brief on this, but I do want to make sure you know we still need Congress to act on provider status. It's critically important. While we've had these nice rulings from HHS that have given pharmacists the authority to prescribe and administer vaccines, both to children and for COVID-19, the fact of the matter is that Congress needs to act in order for pharmacists to actually get paid for that. There needs to be payment. And so it's critical that all of you get involved and activate yourselves through the Take Action Now portal on the APHA website, pharmacist.com, and you can click on the link in the slides. It's an active link. It'll take you directly to the place to fill out a note, send to your congressman. We ask our sister pharmacy organizations to keep the gas pedal on with this. We've got to get this across the finish line so pharmacists can get paid for these services. The authority's there now. the payment has to come as well. So we need to get that done, and we ask all of you to please advocate with your networks of people on social media and in practice to do the exact same. In addition to that, we want to just point out on the next slide, please, that APHA does have some new resources available at the COVID-19 website, pharmacist.com. One is a vaccine storage and handling update that we've provided. We think you'll find very useful. And also, we have detailed out the pharmacist's authority to immunize during COVID-19. If you were on the webinar last week, you know we discussed the new HHS authorities. And the staff have kind of put that in a simple table that helps you understand what the authorities are for pediatrics and for COVID-19 and where there are some differences. And hopefully that will be helpful to all of you. There's all kinds of resources, including things about PPE during the pandemic. And I know that is a hot topic for everybody. We also want to make you aware that there is a CE available, a new one on COVID-19 testing that will be coming October the 14th. This is a live hot topic webinar that's going to happen. COVID-19 testing, understanding the different types of tests and the role of the pharmacy team in conducting those tests. So really, really important. It is a two-step process to register for the CE. So be sure that you get registered for that. It'll run from 12:30 to 1:30 Eastern time on October the 14th. There are other CEs available related to COVID-19, and we'd like to just call your attention to those. It's the time of the year, folks, where we've got to all renew our license. So it's time to get those CEs under belt and to renew those licenses. Next slide, please. We have coming soon a pediatric immunization refresher for pharmacists. It is a 2-hour educational program that's designed to meet the needs of HHS and the requirements that they've put in place for CE certification or annual updates for your licensure and meeting HHS requirements. It's just $39 for APHA members and $59 for non-members. It'll be up and running in a couple of weeks, so stay tuned to the networks for that are coming out and the announcements that'll be happening related to that. We also want to remind you of the Engage platform. APHA's Engage platform is our way of networking with other members, and it's a way of sharing ideas and keeping this conversation going. There is a COVID-19 pharmacy response page on there where we are having great conversations and great discussions about addressing challenges that we face in practice related to COVID-19. So we want you all to be very engaged in that as well. I also want to just take a moment and celebrate for just today, because today is our 25th week. If you can't believe it, I can't believe it. It doesn't seem like it, but we've been doing this for 25 weeks, 25 webinars. All of the topics that we've covered in 25 weeks are listed on the slide. I'll just let you know that you can access them all. They're still on the website at pharmacist.com. You can go back and listen to topics that have evolved since the pandemic began. We've literally had thousands and thousands of pharmacists who've joined us on these weekly webinars over this time frame. And you know, folks, we're going to just keep it going. We'll be back for next week on Thursday, October 1st from 1 to 2 p.m. Eastern for week 26. And we'll keep these conversations going because we know that we're making a difference and pharmacists are getting great information, and we love getting the information from you. I also want to thank everybody for joining us today, because you're having an impact on the future of APHA and the strategic planning of APHA. I want to thank our Board of Trustees for having great listening ears today to hear what members are saying about the priorities of our profession. I want to thank all of you who are members of the uniformed services, whether it be Army, Navy, Marines, Coast Guard, Air Force, the United States Public Health Service, or our Veterans Administration. Your service to our country during a crisis is particularly appreciated, even more so than always, and it always is appreciated. So we're grateful to each and every one of you for the great work that you do. I want to thank you all for joining us. Please join us next week for our webinar at the regular time and regular place. For the coming week, we wish you the best in all that you do, and God bless.